If you're thinking of taking this journey, I have a couple of suggestions for you. One, make sure you're doing it for you, and two, make sure that you have the utmost confidence and feel safe with your surgeon.
It's going to be more a tweaking of the underlying tissues, and I expect you will have a faster recovery.
I'm really glad you're coming along for my journey. There are 4 stages: 1 consultation, 2 surgery, 3 recovery, and number 4, I hope you come back for the big reveal. Dr. Spola, I just want to be a little bit tighter here and feel that my neck is lifted a little bit.
What I'm seeing here is a vivacious, high-energy woman who wants to have a rejuvenation because she wants to look as good as she feels.
I'm a grandmother, but I don't feel my age. I'm here to have rejuvenation for my face and my neck. Why? Because I want to look and feel the best that I can be.
I see, for example, here, this region, we can probably elevate you a little bit further in this direction and give you a improvement in the nasolabial fold, in the jowl, and in the fine wrinkle pattern.
Am I nervous? Not at all. I'm very, very excited because I have the best plastic surgeon.
The scars, I think, will be very, very inconspicuous, and we can do a lot of things to give her the rejuvenation that she wants. This part of your neck is great, except you've got a tiny bit of recurrent crepiness. You've got the glands that are sort of herniated a little bit, sticking out right here, and then you've got that little bit of jowliness. And so I can improve that for you by projecting the skin in an upwards and outwards way. What I do is I lift the skin up and then I put in sutures to elevate this so it has a much more long-lasting result. And then another suture across here to tuck in that herniated gland. What I'm thinking about specifically in terms of planning, really 3 different components. The first is what I often refer to as a purse string mid-lift of the face. What that does is it takes care of the jowls and elevates them in this direction in order to give a nice improvement in the mid-face and the jowl region and a long-lasting result. Second, the neck, she's very thin in the neck, and so she's got prominent submandibular glands because they can be seen. And what I intend to do there is not to remove the submandibular glands. Many of my colleagues these days are doing that, and I don't think that's a good thing to do because the submandibular glands are there to produce saliva, not just to be removed in order to achieve a better neckline. Instead, what I'm going to do is I'm going to carefully put sutures in to plicate and tighten and imbricate the submandibular gland back into a less prominent position, and in addition, improve some of the residual lines she's got in her neck. Next component related to that also is to rejig the skin of the neck and move it backwards a little bit, but without excessive tension, because I want her to have very good healing of her scars and I want her to have a rapid healing overall. The third component, structural fat, I call it. What that means is I take fat from another part of her body, often her tummy or her flanks, and then I carefully put small amounts of that fat into areas of the face where it needs a little bit more prominence or a little bit of smoothing. So typically the malar region or the cheekbones, the nasolabial folds or the lips or both, sometimes a little bit in the chin, and sometimes into the neck. So I may put a little bit here, may put a little bit here.
I can't wait.
I think this is going to be a great journey for this patient, and I expect that she's going to get great results.
Welcome to my journey.